Gynecologists and obstetricians have been challenged to strive towards improving the health conditions of pregnant women and their newborn babies in Nigeria. At the 48th Annual General Meeting and Scientific Conference of the Society of Gynecology and Obstetrics of Nigeria, SOGON, held in Asaba, the Delta State capital, and attended by the state's governor, Emmanuel Uduaghan, the president of SOGON, Dr. Fred Achem, appealed to President Goodluck Jonathan to sign the National Healthcare Bill into law and also urged state governments to adopt the Maternal Death Review Program as provided by the United Nations.
We seek to perpetually improve the health of women, reduce maternal mortality and morbidity, and do well in our embrace to continually advance the science and the practice of obstetrics and gynecology. We do this as we record programmatic activities between our members, thereby strengthening their knowledge and skills, and even engaging in international and national partnerships.
While commending SOGON, Governor Uduaghan urged the medical experts to continue to assist in the national efforts to improve maternal and child health care across the country.
From the inception of this administration, we have embarked on critical programs in the health sector, which includes implementing the free maternal and under-5 healthcare program with the aim of effecting a sustainable reduction in maternal and newborn deaths in the state. The horizon of this extends to tackling gynecological malignancies in resource-poor settings of our rural communities. This has been effected through community education and mobilization, rural healthcare program, capacity building for health workers, activation of the referral system, institution of screening exercises, and sustained advocacy to our people at all levels. Our free maternal health care program started in November 2007, and we are still on till today.
In wrapping up the program, awards were presented to well-deserved members of the society for a job well done in the past years. And the Ebola virus remains in the news. While the World Health Organization says the outbreak of the disease is now stable in Guinea, where the latest crisis began, gains in Sierra Leone may be reversed as burial workers in the country's city of Kenema dumped bodies in public in protest at non-payment of allowances for handling Ebola victims. The workers who have gone on strike over the issue left bodies abandoned at the city's main hospital. One of the bodies was reportedly left by the hospital manager's office and 2 others by the hospital entrance. The burial workers said they had not been paid agreed extra risk allowances for October and November. Sierra Leone is one of the countries worst affected by this year's Ebola outbreak, with more than 1,200 deaths. Let's go on a quick break and we'll be back to look into how achieving the Millennium Development Goal 6 can help attain Goals 4 and 5. Just stay with us on the program.
If you want to know what's trending or you miss your favorite live shows, you can watch it all on our YouTube channel. Simply log on to www.youtube.com/channelsweb. Scroll down to your favorite program and click play. You can also view all uploaded videos by clicking on View All. Don't forget to subscribe and get the latest videos. If they are interesting, like them and be heard. Get connected with the channel's television YouTube page. The news at your fingertips.
The United Nations Millennium Development Goals, MDGs, are 8 goals that UN member states have agreed to try to achieve by the year 2015. Signed in September 2000, the MDG commits world leaders to combat poverty, hunger, disease, illiteracy, environmental degradation, and discrimination against women. Specifically, Goal 4 seeks to reduce by 2/3 between 1990 and 2015 the under 5 mortality rates, while MDG 5 targets improved maternal health. The Millennium Development Goal 6 is to combat HIV/AIDS, malaria, and other diseases. How far has Nigeria gone? Let's hear from the Acting Director, Programs Coordination of the National Agency for the Control of AIDS, NACA, Dr. Priscilla Ibekwe.
Thank you so much for speaking with us on Health News.
Thank you.
The Millennium Development Goals, is particularly the Goal 4, 5, and 6, which have to do with health. The target here is here. Let's look at how far Nigeria has gone, particularly in the area of HIV, AIDS, and the Goal 6.
The MDG 6, as you rightly said, is about trying to reduce HIV, as you say, and malaria. But the component that NACA, the National Agency for the Control of AIDS, is responsible for is reducing HIV and AIDS in the country. And we've done quite well, over the years. For example, there's clear records that HIV incidence and prevalence is reducing in Nigeria. The National AIDS Reproductive Health Survey from 2007 shows that the national prevalence of HIV is 3.6%, but the one that was done in 2012 clearly shows it's about 3.4%. Although it's a little percentage point difference, 0.2% difference. When you translate that to the numbers of people who are in Nigeria, it means we have really come down. So there's clear evidence.
Not really come down.
Well, yes. Well, considering the fact that Nigeria has a very big population of about 170 million people, every percentage point counts. So the incidence, the number of people having HIV is reducing, and the number of people who are living longer with HIV is also increasing because we have increased the number of people. There's national efforts, both from the national, state level efforts to get people into treatment. There are now, as at 2013, over 600,000 people on treatment, and that's been a tremendous achievement. From 2012 to 2013, at least 180,000 Nigerians were put on treatment in 1 year, and that is a big jump from the work that we have done in previous years. And it's not just NACA alone, it's a national thing. The state people are working, the local government, there's work being undertaken at the local government level. So coming together, we are making some progress, but a lot still needs to be done.
Okay, now let's talk about funding and, of course, the Presidential Comprehensive Response Plan. How do you think this would help in achieving Millennium Development Goal 6?
Nigeria has increasingly contributed to funding for HIV. For example, in 2012, I think the percentage point of funding is about 24%, a big increase from the previous years. And in 2013, as you know, the president was very concerned about the progress in HIV, and he wanted a lot more done. And he had a presidential parley and asked for a plan to be, a plan to be developed, a comprehensive plan to be developed, and this was done and unveiled to the world in July 2013. And money has been committed to this. About 8 billion naira has also been committed for this cause. So increasingly, the country is making progress in putting money, funds into HIV response. And this is in line with the plan. The President's plan, the key objectives are to ensure that we have about 80 million Nigerians test for HIV. It's important for people to know their status. 40 million people in this year and 40 million people in 2015. The more Nigerians know, the good news is that a lot of Nigerians do not have HIV. But when they know they don't have HIV, it helps them to remain negative. They make more effort to stay negative. And those who are positive, we want them to go into treatment. And so through the MDG funding, we're also increasing the number of people who know their status. It's only 30% of people who require treatment who are currently on treatment. And that's part of the reason why we are raising awareness about HIV, doing the HIV testing campaign, and getting people to know their status and direct them into treatment. These are some of the efforts that we are doing at the national level, and we're also pushing that this is also done at the state level. In terms of achieving MDG, we haven't quite reached there, but we are actually in the correct, we are making progress in the right direction.
Okay, and now let's go back to the issue of testing 80 million people. Where are we now? Which states have we been able to get to? Where are we, and what more would you want the people to know?
I'd like to say that we've taken a strategic approach to this. We know that people live with now. HIV is across the whole country, but there are 12 plus 1 states, 12 states in the nation, including the FCT, that have the highest burden. They contribute to about 70% of the burden of HIV. So ideally, what you want to do, we've taken a strategic approach to make sure that a lot of work is going on in those areas. Every state, we are asking that every state beef up and scale up their state response, but particularly, it's in a strategic way. It makes sense that when you have limited funding, your focus is on the states that have the highest burden, and these are the states that will give us the highest returns. You have the FCT, Nasarawa, Benue, Lagos, Oyo, Rivers, Taraba is Abia. So there's a lot of technical support that's going to happen from NACA to the state. There's a lot of liaising and ensuring that the states actually beef up and scale up their response.
The Millennium Development Goals, especially the ones that have to do with health, they are interwoven. How do you think Goal 6, which is about HIV, malaria, and other diseases, how do you think tackling Goal 6 will help improve maternal health and, of course, child health?
Obviously, we know that we have about 240,000 pregnant, HIV-positive women that are pregnant on a yearly basis. And so what we want to do is to ensure that these women get tested, are aware that they have HIV, and get into treatment. We want them to have treatment during pregnancy, attend the antenatal clinic, have their ARVs during and after pregnancy, and also while they are breastfeeding their babies. What is important is that we want women to be known, for them to know their status and get treated. And the risk of transmission to them is transmission to the babies will be less. Therefore, it's possible. It's been clearly demonstrated in other countries, it's clearly demonstrated in developed countries and also countries in Africa, that we can actually bring down transmission of HIV to the baby. And if you have an HIV-free baby, you have a well baby, and mother on treatment, you keep that mother healthy. And in that way, we increase the health outcomes, both for the mother and for the child.
Thank you so much for sharing your thoughts.
Thank you.
As World AIDS Day is marked globally, there will be more discussion on the HIV/AIDS situation in Nigeria on the program next week. And my guest will be the Director General of the National Agency for the Control of AIDS, NACA, Professor John Idoko. Thank you for being with us. I am Yomi Otaigwe.